Well over 2 million people in the United States, they have glaucoma, and half of these people don't even know that they have it. So now we are in the offices of Dr. Nancy Balin. We're talking about glaucoma, and Dr. Balin, you know, January is National Glaucoma Awareness Month, but for those of us out there, including myself, who is unaware, what is glaucoma?
Glaucoma is a condition where the eye pressure in the eye gets too high and causes damage to the back of the eye in the optic nerve and can result in loss of vision and finally blindness if not treated. Probably the most important risk factor for glaucoma is heredity. And so if any family members have it, it's very important to get checked for it. There's certain groups that are the higher risk for glaucoma, such as Afro-American or Asian or Hispanic. Okay. Also, some people are more prone to glaucoma if they're on certain medications, or people who have steroid medications can possibly be at a higher risk for glaucoma.
What are some of the symptoms of glaucoma?
Well, glaucoma is actually symptomless. And so people do not know if they have glaucoma, and that's why it's really important to come in for an eye examination. The high pressure in the eye usually is not felt or detected, and so it's important to come in for an eye exam to have a thorough examination to make sure that you do not have glaucoma. It's important for people under the age of 40 probably to have eye exams every at least 2 to 3 years. And there's a higher incidence of glaucoma as we get older, and so over the age of 50, it's recommended that people come in at least every 2 years to have an eye examination, and over the age of 65, it would increase to once a year.
How exactly do you go about diagnosing glaucoma?
Well, during the course of a routine eye examination, one of the things that we always check is eye pressure. And eye pressure is one of the variables that we look at. In addition, there are different types of glaucoma, and there actually is a condition called normal tension or low tension glaucoma, where actually a person might not even have high pressure, but they have glaucoma. And this is because the high pressure can cause damage to the back of the eye and the optic nerve, and the people develop what's called a big cup in the optic nerve, or excavation of the optic nerve. And so we look at the optic nerve to make sure it looks healthy, and if there's any suspicion of glaucoma with either the pressure or the optic nerve configuration, then we will go on and do further testing. Further testing would be visual field testing to test the peripheral vision, because that's actually how people start to lose their vision. They lose their peripheral vision. And in addition, we have other tests such as ophthalmic photography and also optic nerve head imaging to help follow people and determine whether or not they have glaucoma.
If someone is diagnosed with glaucoma, what can they expect?
Well, the good part about it is that glaucoma is treatable. And so the purpose of treatment is to lower the eye pressure, and we do that in various ways. Number one, we can use medication or eye drops for glaucoma, and that's to control the eye pressure. And often we'll also use laser treatment for people who don't want to use drops or want to try the laser, because very often the laser will control the pressure. And if for some reason it cannot be controlled with drops or laser, sometimes surgical intervention is needed. So in addition to using eye drops and medication and or laser treatment to control glaucoma, there are other modalities that are really helpful, which are surgical modalities. One of them is called an eye stent, which is a device that's placed in the drainage portion of the eye to help outflow of fluid and to lower the eye pressure. And for advanced glaucoma, actual surgical intervention is needed with procedures called trabeculectomy and shunts.
Dr. Balin, is there any way that we can go about preventing glaucoma?
There's really nothing to do to prevent glaucoma. Glaucoma is really only treatable by lowering the eye pressure, so a person really can't do anything. Actually, some people always ask if I get my blood pressure lower, can this help? And the blood pressure and eye pressure are actually unrelated.
Okay. Dr. Balin, thank you so much. You know, so many people, especially seeing as it's Glaucoma Awareness Month, are talking about this, so I'm glad we could get some good truth out of you.
Well, thank you so much, and thank you for inviting me.
For more information, you can go to balineye.com.